This skin condition is something I see very often in the office. It is characterized by a dark neck that is usually rough and velvety in texture and can be also seen in the underarm area, the groin area, and sometimes it can show up on the face as a dark patch. This condition is called Acanthosis Nigricans, and we're going to talk about it today. Hi everyone, my name is Dr. Degha Fongod. Welcome back to the channel where I talk about all things skincare and insulin resistance. So what is Acanthosis Nigricans? It is a skin condition where you have a thickening of the skin in areas of the skin where the skin tends to rub. So stereotypically, you will see it in the neck area, you will see it in the groin, you will see it in the underarms, and in those areas, typically you will see other things such as skin tags that tend to be associated with it, so they tend to come together. But it shows up in different forms. So for example, you can see it on the face as a dark velvety patch on the side of the face. You can see it in terms of having darkening in the elbows, the knuckles, and the knees as well. So it's not just located in the neck. It can be located in different parts of the body as well. Acanthosis nigricans can be associated with diabetes, PCOS, obesity, and underactive thyroid, Cushing's disease, and rarely it can be associated with malignancy, but that's really, really rare, and it's only of concern if the acanthosis nigricans occurred very, very suddenly. And usually for most people, this skin condition happens gradually over a period of time. At the root cause of this condition is insulin resistance, and insulin resistance occurs when you have hyperinsulinemia, so high levels of insulin in the blood over a period of time, in addition to dysfunction of some insulin receptors in the body. One of the most common times that you will see this condition is around puberty. And the reason this happens is because puberty is usually a time when your body goes through something called physiological insulin resistance. So your body puts you in a state of insulin resistance for the purposes of growth and for the development of your secondary sexual characteristics, okay? And so a lot of times if somebody was obese or overweight prior to puberty and then they go through a state of puberty, then they tend to then have more insulin resistance than usual, and then we will see this skin condition where they have darkening in their neck and in their face and the groin area, especially the underarms. And a lot of times people think, it's because you're dirty or you're not cleaning your neck area properly, but that is not the case. It's just that because you have high levels of insulin in your blood, it leads to hyperkeratinization or a lot of keratin or skin buildup. So you get this velvety, thick, rough skin in this particular area. And so the best way to actually deal with this condition is going to be reversing insulin resistance. But I'll first talk about some of the skincare things that you can do to help with this condition. And then we'll talk about insulin resistance and some of the lifestyle changes that you can make to improve insulin resistance. So in terms of skincare, because this is a hyperkeratotic state or there's too much skin buildup, kind of similar to keratosis pilaris, you want to use similar ingredients to try to treat it, okay? So first, you want to start with acids. You can start with something like salicylic acid. You can use glycolic acid or lactic acid. These are all things you would use in KP. You can use these acids in the area to try to exfoliate the skin. Another thing that you can use is you can use ingredients like urea. You're looking for something that has about 30% plus percentage of urea in the lotion. And again, usually these are targeting hyperkeratotic states to help with exfoliation. One last thing that you can use is going to be retinoids. You can use something like adapalene over the counter, or if you have access to tretinoin, then you can use tretinoin. I will put a link below of recommendations for products that you can do. But these three types of skincare ingredients are going to be helpful to help with exfoliating the skin. You can also do mechanical exfoliation in this area because, again, the problem is that there's too much skin buildup in the area. So if you can mechanically exfoliate it, don't do too much, but a little bit will help with exfoliating the skin so you can get smooth texture of the skin. But this is just the superficial way of dealing with it. At the root cause of this condition is insulin resistance. And so it's going to be important to work on reversing insulin resistance. I have a course on this topic, which I will link below. But some of the key things when we're talking about insulin resistance is you're going to start with diet. And the most important thing dietary wise is going to be making sure that you cut out processed carbohydrates and sugars in your diet, because those are the things that elevate your glucose, and high glucose is what leads to high insulin over a period of time. So you want to cut out processed carbs and cut out sugars. You want to limit how often you're eating, and so I always am a proponent of intermittent fasting. So you might want to do 2 to 3 meals a day instead of meals plus drinks, which are considered meals. And so you end up having like multiple meals in a day and having multiple insulin spikes. Now let's talk about some of the lifestyle changes that need to be made in order to decrease insulin resistance. So the first thing is going to be keeping cortisol low. And you need to do this, one, by making sure you're getting enough sleep. Not just the amount of hours, but the quality of sleep is important. The second thing is going to be decreasing other types of stress. This could be work-related stress, relational stress, all of that, because any amount of cortisol in the body will lead to chronic inflammation in the body, which will then lead to insulin resistance. And then insulin resistance then leads to more inflammation, and it's just this vicious cycle. So you really want to make sure that you keep stress low and you keep cortisol low. Okay, so those two things are going to be very, very important. Another thing that you can do is incorporating exercise into your regimen. So you want to do low intensity exercises such as walking, or you could do yoga, Pilates, things like that. And obviously building muscle is going to be very, very important because it helps you with glucose control. So you want to focus on strength training if you want to go to the gym. All right. And so all of these things are going to help you keep your insulin low. That way, once you start to reverse the insulin resistance, for some people, if obesity is part of the problem for them, then you're going to start to lose weight. And as you lose weight, you're going to notice that the Acanthosis Nigricans is going to get better. The last thing I want to say about Acanthosis nigricans is that it is a warning of insulin resistance. And so whenever you see something like Acanthosis nigricans or skin tags, it's basically your body's way of telling you to pay attention to what you're eating and your lifestyle, because again, this condition can lead to things like diabetes and PCOS, and those have other consequences like cardiovascular disease and heart attacks and strokes. And so we want to do everything possible, especially if this is showing up in your teen years. You want to do everything possible to make sure that you reverse this condition, because later on down the line, if you're a woman, for example, this can pop up again during pregnancy, because that's another state where you get physiological insulin resistance. And so you might end up with something like gestational diabetes, which again is very, very difficult to deal with. So always pay attention to what's happening on your skin and ask the question, what is this skin condition trying to tell me? And in this case, it's insulin resistance. So if you need help with learning how to reverse insulin resistance, I'll leave a link to the course below. If you're in the DC metro area and you're looking for someone to help you with insulin resistance or skin conditions related to insulin resistance, then I will leave my office information below. All right, I hope you enjoyed this video. Let me know what other topics related to insulin resistance you want me to talk about, and I will make a video about that topic for you. All right, I hope you have a great day. Bye.